Telehealth is becoming more and more prevalent in today's society, and we thought it was important to go over the basics of telehealth and what makes for a successful telehealth visit. Specifically focused on mental health checkups with a PCP in younger populations, we will explore the do's and don'ts of the virtual medicine. Within our presentation, we will introduce telehealth and mental health in the teen population and provide some stats regarding the rising use of telehealth. We will then give 2 examples of what to do and what not to do during a telemedicine call in regards to communication techniques. We will also provide some key takeaway points you can use in your future as a healthcare provider. Telehealth can be defined as the use of technology to facilitate long-distance care, education, teamwork, and disaster response. Common illness or infections, follow-up visits, talk therapy, management for a chronic condition, special visits, or physical therapy are some of the reasons telehealth visits will be used as opposed to an in-person doctor's visit. Along with telehealth comes the benefits of increased access, cost-effectiveness, no transportation required to get to the appointment, and a lessened risk of spread of infection. The patient's level of health literacy, lack of access to internet or a device to use, privacy concerns, and the limitation to do a physical exam are a few of the barriers to effective communication during telehealth. 13 to 17% is the estimated amount of patient-provider interactions that has occurred via telehealth in the United States in 2021. There has been a 38-time increase in telehealth usage compared to pre-pandemic times. Over 70% of patients expect to access virtual care post-pandemic. Younger patients find telemedicine to be more comfortable and convenient as opposed to in-person doctor's visits. These calls also allow a glimpse into the home environment and are preferred by patients that may have challenges getting to appointments.
Let's just go ahead and get this started. So what seems to be your problem today?
Yeah, hi. I've just been feeling really depressed and down lately. Ever since school switched to being online, it's just hard to get out of bed in the morning. I also find it really hard to be away from my friends since I used to see them every day at school, so I'm feeling really lonely now. My lifestyle just doesn't feel the same as it used to before the pandemic.
The pandemic's been hard for everyone. Are you still doing your homework?
Well, no, it's hard for me to do any schoolwork. I'm so unmotivated.
Have you been working out? I've heard exercise is definitely a mood booster.
No, I'm unmotivated. Like I said, I was just really hoping I could talk to someone who could offer insight, like a therapist or something. I just scheduled this appointment for a referral then, I guess.
Okay, that sounds great. I'll just go ahead and...
Hey doctor, I need you to sign this form.
Okay. Yeah, I'm not super busy right now anyway, so just go ahead and do that. Thanks.
Thanks.
So as I was saying, I'll just go ahead and refer you to a therapist and you can tell them your problems. All right, good meeting you.
Oh, okay, bye then.
Bye.
That felt like such a waste of time. She didn't listen to anything I was saying.
Verbal communication includes how questions are asked and how they are responded to. Nonverbal communication includes body language and your environment. In terms of nonverbal communication, the biggest problems in this example were the lack of eye contact by the provider and the many distractions the provider encountered during the call. The lack of eye contact and the many distractions make the provider seem uninterested and disengaged in the conversation. In terms of verbal communication, the biggest problems in this example were the type of listening and the closed-ended questions. The provider was not practicing reflective listening, which is summarizing what the patient is saying. This makes it seem as though the provider is not listening to the patient. The provider was also asking closed-ended questions, making it hard for the patient to respond beyond yes or no.
Hi there, I'm Dr. Cornett. It's so nice to meet you, Isabel.
Hi, it's nice to meet you too. Thanks for seeing me today.
So I see here in your reason for appointment that you've been struggling with school and mental health due to the pandemic. Can you tell me how that's been?
Yeah, so I've just been feeling really depressed and down lately. Ever since school switched to being online, it's hard to get out of bed in the morning. I found it also hard to be away from my friends, and I just feel lonely since I don't see them every day now. My lifestyle just isn't the same as it used to be before the pandemic.
It sounds like you have had a big change in your lifestyle. Can you tell me what your day-to-day typically looks like?
Yeah, so for the past few months, I've struggled to wake up on time for class, which starts at 8 a.m., so I end up just snoozing my alarm. And lately, my parents have been so mad at me for not showing up on time for my online classes. classes. But when I do log into class, I just feel distracted by my phone and social media, and I just don't feel motivated to listen.
So it sounds like I'm hearing that online school has made it really hard for you to be motivated and stay focused. What have you tried to do about that so far?
I have tried taking steps to limit some of the distractions, like putting my phone in another room and then organizing some online study groups with my friends just so I can stay more motivated and focused.
It sounds like you know what changes you have to make, which is awesome. Creating a school-life balance may be challenging, but it is definitely important for your health.
Yeah, it's been nice to just talk to someone about how I've been struggling. I guess I do know what steps to take.
It sounds like you would benefit from a therapist to talk more about this difficult change in your life.
Yeah, I think it would help to talk to someone who could offer insight into improving my lifestyle.
Great. I'll just go ahead and set
Doctor,
something.
I have this form I need you to sign.
I'm so sorry, but not right now. I'm with a patient. I'll be right there after my call.
Okay.
I'm so sorry about that. I typically put a sign on my door when I'm on a call, but I'll just go ahead and refer you to a resource for coaching and therapy right away.
Thank you. I'm looking forward to getting my life back and organized.
Of course. I'm so glad I could be of help to you. Have a great day. Bye.
Bye-bye.
What was successful in this example? In terms of nonverbal communication, the provider maintained eye contact and limited distractions during the call. This allowed the provider to appear engaged in the call and focus on the patient. In terms of verbal communication, the provider asked open-ended questions and practiced reflective listening. The open-ended questions, which are questions that need more than a simple yes or no answer, facilitated storytelling and allowed the patient to explain what they were experiencing. The reflective listening allowed for the provider to tune into the problems that the patient was experiencing and stay engaged with the patient.
The main takeaway for primary care physicians when it comes to telemedicine is that the verbal and nonverbal communication that they use are both important aspects to telehealth and are vital to the determination of success of the call and facilitate effective communication with the patient.